Hi, everybody, and welcome to Medical Informatics with Dr. Mike. Today, we're going to talk about a subject that tends to be a bit of a sore point for a lot of clinicians, and that is clinical decision support, or CDS for short. Now, the reason why this is a sore point is that there is a lot of bad CDS out there. Things that get in the way of the workflow, things that don't really provide any value, things that don't really move the needle on the quality initiatives different groups have. The way you can avoid that in the EHR that you spent millions of dollars installing is to follow the 5 rights of decision support. What are the 5 rights? Right information, right person, right intervention, right channel, and right time in the workflow. We're going to step through each one of these one by one so you can know how to leverage them in crafting and reviewing the CDS you have in your system. Now, the first and arguably most basic of the 5 rights is to make sure it's the right information. I mean, it doesn't do any good to present people with the wrong information or information that's out of date. For example, is that antibiotic you're suggesting really still the best choice for first-line therapy in community-acquired pneumonia? Is that antihypertensive really the best thing to suggest to a patient in this particular clinical scenario? Now, a part of this, one that I think gets overlooked a lot, is that it isn't just about making sure you have the right information up front. It's monitoring these interventions over time and having a regular cadence to review the information, because obviously things get updated and recommendations change. A big part of that is having some kind of governance structure around your clinical decision support to review these things, to make sure you're following up on them on a regular cadence. The second right is the right person. This one can be a little tricky because it really is a fundamental understanding of who is going to act on this information. Is this something a doc needs to know about, something a nurse needs to know about, something the registrar needs to know about? So here's an example in this current COVID pandemic. Especially early on, there were a lot of interventions geared at warning a person if the patient in front of them had been exposed to COVID or had symptoms concerning for COVID. Presenting that to the doc is too late. Presenting that to the front desk staff makes more sense because that's when they can intervene about putting the person in a special room, making sure everybody's wearing masks, whatever. So making sure that you're targeting the right person is absolutely critical. The next one, the right intervention, I actually think is one that people overlook quite a bit. I know that in the groups I've worked with, oftentimes when we talk about decision support, the very first thing that comes to mind is some pop-up. Oh, we want to stop people and we got to warn them about XYZ. And sometimes you do want to pop up. There are times when you really want to stop someone in their tracks and say, wait a second, you need to devote full attention to what I'm talking about right now because what you're doing is potentially dangerous or you're missing something or whatever. But most of the time, that really isn't the best way to guide somebody. Order sets are an example of something that's much more in line with what a person's doing and actually helps guide them in a better way. If I'm admitting somebody with, again, let's say community-acquired pneumonia, and I've got an order set that naturally guides me to prescribing the best antibiotic, that's a much better intervention than if I put in a diagnosis of community-acquired pneumonia and I get some pop-up that's saying, hey, do you want to order this antibiotic when I'm not even on my orders yet? So the right intervention is really important, and be creative about what that intervention is. Again, sometimes it's a pop-up, sometimes it's an order set. Sometimes it's just a note template to make sure people have thought through things. But anything that you're using that helps frame things for an end user or helps guide their thinking is really decision support. So use all the tools available to you, not just a pop-up. The next right channel, is very similar to the right intervention, but it is a reminder that sometimes we can help guide decisions when we're not actually right in the middle of the workflow. So what do I mean by that? Yes, a lot of clinical decision support is tied to the EHR in some way or form, but maybe that's not the only way to do it. For example, you may have an easy way for clinicians to pull up some clinical reference. Obviously, UpToDate's one of the most common ones. There are others as well. But if I have access to that so I can review information, like what's the current guideline therapy for people with community-acquired pneumonia, then I can look at the information and know what I'm supposed to order. Even if the system doesn't recommend something to me, having access to that information is important. Even something simple like having an email that says, hey, by the way, we're having a lot of resistance to XYZ antibiotic or bacteria rather, so make sure you're using a different frontline antibiotic can be helpful. It might even be low tech. Like, don't forget, decision support can be non-technology. Posting something up in a break room or something like that. All of these are ways to help guide decisions. Again, be creative. The last right time in the workflow, I think, is the one that typically, when it's not followed, is the one that irritates the end users the most. Going through, putting in my order set, all ready to go just to assign it, to admit this patient with pneumonia, hit the sign button, and then I get a pop-up that says, nope, sorry, you ordered the wrong antibiotic, go change it. Well, I've wasted time, right? Thinking about what I'm going to order, ordering it, and going to sign it. The right time to intervene was before I put the orders in the first place. It's a lot like the COVID example too. If I'm the doc in the room talking to a patient and suddenly I get a pop-up that says, hey, this person's high risk for COVID, which admittedly at this point in the pandemic/endemic, almost everybody is, but back early in the early days especially, seeing that at that point doesn't do me any good. 4 or 5 people in my office have already been exposed. So the right time in the workflow is when the patient scheduled the appointment or first walked in the door. Thinking about the right time in the workflow will save your end users a lot of headaches. So that's the 5 rights. Obviously, this goes really deep into these, but if you think about these, every time you're managing clinical decision support, it's almost a guarantee that your CDS interventions will be better. Make sure you're focusing on the right information presented to the right person with the right intervention through the right channel, and very importantly, at the right time in the workflow, and your folks will be happier. Thanks for watching.